we just signed is a cooperation agreement between the Dutch government and the AIM partners, the Amsterdam Initiative Against Malnutrition. There's a contribution from the Dutch government of 11 million euros. There's a contribution from the other partners of about 14 million euros. And so together it's an envelope of about 25 million euros to roll out this program across Africa, mainly. Our goal is to reach up to 7 to 10 million Africans and improve their nutrition and health status. The other goal is actually to show a range of models that can work, where we can actually scale up around the world, where we can actually not only show that it can be profitable for companies, but also that they can have a positive outcome for the poor who are suffering from malnutrition.
Malnutrition is a key issue. 2 billion people in the world miss nutritious food. Maybe they have enough calories, but they miss micronutrients. And that's really bad for their health. All the partners, 25 right now, started with 7 and now it's 25 partners, work together to set up whole value chains that produce a healthy diet that's affordable for the poorest of the poor also in Africa. And this is a challenge, but this is the best example of such a program I've seen so far, and I really expect quite a lot of it.
We need agriculture that delivers nutritious foods. We need markets that work for the poor. We need new products that deliver the nutritional nutrients that people need, especially young children and pregnant women. We need all partners together, coming from agriculture, coming from science, coming from civil society and coming from business, to help develop these solutions. And quote me, solutions plural, because we cannot do it just by one solution. One golden bullet does not exist. We have to combine our forces to tackle malnutrition.
We feel that this partnership is important because it's able to bring many different groups of people together who all want to achieve the same perspective. We are able to bring in scale, we're able to bring in affordability, and the ultimate aim of this project is to get the product to the end user at the most affordable price. And that's why I think this initiative is important.
To get the nutrition community on side requires a really massive effort. Inside the Sun movement, I am facing a massive, massive tension, which just gets more and more profound because of this core distrust of business. And AIM is the laboratory where this can be dealt with face up.
We must work together here because this is probably the only way we can actually make real progress in this important field of nutrition security. The train left the station, programs are being drafted here, commitments being made, expectations are being raised here. Rest assured, we will deliver.
Because we are convinced that we are all part of one human race, that every human being has a right to an equal life, that every mother wants her child to succeed, and that our job is to provide the tools, the technology, the information, the data that makes that mother have the capability of changing the life of her child and her family and her situation.